guys, I will explain about diabetes mellitus. Before I explain about diabetes, I will introduce myself first. Don't know, don't love me. My name is Cecilia Octaviania Rahastri. I'm from Ma'arif Assimilative University, Faculty of Health Science, Diploma 3 Medical Laboratory Technology. So this was the introduction. Brief about me. Now let's add the material. Diabetes mellitus. Diabetes mellitus is a metabolic disease caused by the interaction of various factors, genetic, immunologic, environmental, and lifestyle. Diabetes mellitus is a collection of symptoms that occur in someone who is caused by an increase in blood glucose levels due to a progressive decrease in insulin secreted due to insulin resistance. According to the American Diabetes Association, diabetes is a complex and chronic disease that requires treatment, continuous medical treatment with glycemic index control strategies based on multiple risk factors. Symptoms of diabetes mellitus. Symptoms that appear in people with diabetes mellitus include polyuria, loss of urine. Polyuria is an early symptom of diabetes that occurs when blood sugar levels above 160 to 180. Blood glucose level. High blood glucose level will be excreted through urine. If the blood glucose level is higher, the kidneys produce large amounts of urine alone. Polydipsia drink urine. Polydipsia occurs because a lot of urine is excreted, so patients will feel excessive thirst so that they drink alone. Polyphagia, a lot of eating. Polyphagia occurs due to reduced insulin ability to manage blood sugar levels, so that sufferers feel hungry excessive. Weight loss. Weight loss occurs because the body breaks down surplus the energy in the body such as fat. Classification of diabetes mellitus. Type 1 diabetes mellitus. Type 1 diabetes mellitus occurs due to degradation of pancreas beta cell due to autoimmune cause. In this type of diabetes mellitus, there is little or nothing insulin secret can be determined by the level of protein C peptide that is few or no detectable amounts. The causative factor for type 1 diabetes mellitus is a viral infection or damage to the immune system caused by reaction autoimmune damage to insulin production cell in pancreas. As a whole, diabetes mellitus patient to survive most. Insulin is given by injection in the patient's body area. If insulin is not given, the patient will become unconscious, also known as ketoacidosis or diabetic coma. Type 2 diabetes mellitus. In patients with this type of diabetes, hyperinsulinemia occurs, but insulin cannot bring glucose into the tissue because it occurs insulin resistance, which is a decrease in the ability of insulin to stimulate glucose uptake by peripheral tissue and to inhibit glucose production by the liver. Type 2 diabetes mellitus is caused by the relative failure of cell pancreas and resist- insulin resistance. Insulin resistance is a decrease the ability of insulin to stimulate glucose uptake by peripheral tissue and to inhibit glucose production by the liver. Other type of diabetes mellitus. This type of diabetes occurs as a result of metabolic disorders caused by an increase in blood glucose level due to genetic factor beta cell, genetic defect in insulin action, disease of the exocrine pancreas, other endocrine metabolic disease, iatrogenetic viral infection, autoimmune, and other genetic syndromes associated with disease diabetes mellitus. Gestational diabetes mellitus. This type of diabetes occurs during pregnancy, where intolerance glucose is detected for the first time during pregnancy, usually in the second and third trimester. Patients with gestational diabetes have greater risk of suffering from diabetes that persists in the long term 5 to 10 years after delivery. Diabetes mellitus risk factor. 8. The occurrence of type 2 diabetes mellitus increase with age, or the number of production cells decrease with age. Weight obesity prevalence and diabetes is positively correlated, especially central obesity, one of the main risk factors for the occurrence of diabetes mellitus. Obesity can make cells insensitive to insulin or insulin retention. The more fatty tissue in the body, the more resistant it is to insulin action, especially when 16 body fat accumulation in the central or abdominal area. Family history. A parent or sibling has diabetes mellitus. Lifestyle. Lifestyle is a person's behavior that's shown in daily activities. Fast food or junk food, lack of exercise, and fizzy drink are factor triggers for type 2 diabetes mellitus. This is a diabetes mellitus card. Thank you. Don't forget to like. Bye bye.